HansenAthletics. So today we're going to talk about a couple things in regards to sciatica. So we hear all the time I have sciatic pain, have lower back pain, and sometimes that's kind of jumping to conclusions when it comes to what your actual symptoms are. So two things to try before you go and get too serious about saying you have sciatic pain. Number one is going to be making sure you do stretching and foam rolling. So targeting the correct areas to relieve some of this pain. So the first part of that is going to be with the foam roller focusing on the glutes, okay, so the butt cheek and the side of the hip. So you'll want to work through that. Probably spend 5 to 10 minutes on each butt cheek, working through the back side, so the actual glute, or into the side of the hips and working up into the hip. And to keep it frank with you, this is going to hurt. It's got to hurt. So if you're doing it gently, you're not really going to be getting into the tissue. So it's going to be important that you foam roll, you take it serious. You can also use a softball, a baseball, anything that's going to really dig into that tissue. So we're going to want to work all through the side of the hip and the glute, okay? If you find relief immediately from this, that means it's probably more of a tissue issue rather than actual sciatic pain. So number two is going to be your pelvis orientation. So when you're training, when you're squatting, when you're planking, when you're doing any kind of trunk exercise, pay attention to where your hip is in orientation to your trunk, okay? So if you're getting sciatic pain, most likely you're being pulled into an anterior pelvic tilt. We also call this Instagram booty, okay? This is when your butt is sticking out, chest and ribs are flared open, and you're in this position all day long. So we see this all the time in the plank. We see it all the time when people go to squat. It's a position that people live in because we sit a lot, okay? So it's going to be important to keep that pelvis stacked through movement. So when you're planking, if you've ever watched a gymnast do planks or any kind of trunk exercise, they're very specific on keeping those hips underneath. That's going to be what you want to maintain through all your movements. And if you start there, so start focusing on that, foam rolling, that is going to be a good indicator. If you can relieve any of that pain, then it might be a different issue than what you think it is, okay? Bonus one's going to be stretching the hip flexors or using a psoas or a pso-right. So if you've ever heard of the pso-right, you can look it up. That's going to help you get right into the psoas. The psoas runs through your stomach, so it's a little hard to get to. But typically if you run or if you sit a lot, that muscle can tighten up, and then that's going to pull your hips and potentially get you out of position, which is going to make number two pretty hard, okay? So those are the two things I want you to focus on before you jump straight to run to the doctor, run to the physical therapist. Try those two things out. If you have any kind of alleviation of symptoms and it starts to go away, then you know you don't really actually have that issue, and it's just because you haven't been stretching or recovering enough. Okay, thanks guys.